A 38-year-old coronavirus patient who had to sit on protest outside the municipal corporation in Maharashtra's Nashik after allegedly being turned back by a number of hospitals has died just after midnight on Thursday. Babasaheb Kole was seen on a Dharna wearing an oxygen mask connected to a cylinder. It's a very sad story indeed. My colleague Purva Chitnis joins us for more on this. Purva, what are you hearing about this case?
Well, in fact, a really tragic story coming in from Nashik, and this person named Babasaheb Kole, he was a 38-year-old patient, and in fact his family members say that they tried to get him a COVID bed. They went to a lot of hospitals and they could not manage to find a COVID bed, and in fact the civil hospital gave him an oxygen, but he decided also to protest outside this Nashik civic body's headquarters, and he was protesting there. The visuals of him protesting with an oxygen mask and a cylinder outside the city civic body's headquarters, and after that the ambulance came in and ambulance took him to the hospital, and there at around midnight, post midnight, that's where his oxygen dropped to 40%. Now normally oxygen levels need to be 95 and plus, but his dropped to like 40, and that's when around 1 o'clock is when post midnight, that's when he died. So really tragic story, and again tells the story that how in Maharashtra, with the number of cases rising, still the health infrastructure now is in fact really there is shortage of beds, and health infrastructure needs to be ramped up, because this is a story which is coming in from Nashik, but also in other parts like Nagpur, Aurangabad, Mumbai, Pune. A lot of people are still trying to find a bed, COVID bed, and they're still not able to get a bed. So this is a very tragic story in which the patient had to succumb, and he died. But yeah, the government and the authorities should now ramp up the health infrastructure, considering a lot of the cases coming in Maharashtra, and not just Nashik but all the other districts in Maharashtra. Sure. Desperately need COVID beds to be ramped up.
Absolutely. I'd like to thank you very much for joining us. A very sad story, but it reflects a reality now in Maharashtra where the availability of beds for COVID is a concern.